after hearing the good news that you're pregnant, the next best thing, seeing your ultrasound. Doctor takes a look, says everything is great, but wait, there isn't one, but two bundles of joy. Now, carrying twins is exciting, but you may have to take a few more precautions than a mom who's having just one baby. So we have some expert advice to help moms who are carrying multiples have a healthy pregnancy.
How are you doing?
Melissa Molinex was overjoyed with the news that she was expecting twins.
It was very exciting, but shocking at the same time. Very exciting to know that you're having twins. You know, not a lot of people get to have twins, and when you're able to, it's amazing. It's been an amazing pregnancy.
Having multiples means more doctor visits than during routine pregnancies.
Well, I see Dr. Randall every 4 weeks, and because I'm having twins, I see a high-risk doctor over at the hospital, which I go every 2 weeks just to make sure that they're growing, the growth is, you know, normal, and the weight gain is normal.
Well, what we're doing along the entire 9-month period is monitoring the twins' growths every month with ultrasounds. We'll also do other testing. We are doing monitoring of the babies, making sure that they're growing together. We also will do antenatal testing, which we refer to as non-stress testing, where we'll put the mom on a monitor and monitor the fetal heart rate.
Women who are having multiples are at a greater risk of complications during their pregnancy.
Women who carry 2 babies can develop preeclampsia or elevated blood pressure in pregnancy. They're at risk for preterm labor, premature rupture of membranes. They also have a higher incidence of gestational diabetes. You know, it's basic issues with regards to twins. It's different than having one baby. Patients are obviously very nervous. I think every time when I do that ultrasound, I show them there's 2 little sacs. They don't believe it.
At 24 weeks, Melissa experienced some symptoms of preterm labor and was put on bed rest.
If we're concerned about a patient possibly going into preterm delivery, we are concerned about the lungs. What we can do is give steroids to increase lung maturity, and we still do that between 24 and 34 weeks, regardless of whether or not it's one baby or 2 babies. So, but there may be a little bit more development in the twins just based on the potential for stress that is developed in those 2 babies. And that's why most babies that deliver at 35 weeks with twins do quite well. Many of them will go home with the mom and not require any time in a special nursery. But be prepared for that. If your babies do come early, then you may need to have some additional time in that nursery before going home.
Now in her 34th week of pregnancy, Melissa's looking forward to meeting her 2 little boys.
Seeing what they look like, I'm excited about that. And just knowing that, you know, they come out and they're, you know, very healthy, and which is my #1 is, you know, them healthy, and just I'm excited to see what they look like because you know, they're a part of me now.
For CNN, I'm Catherine Calloway.
And for more information about carrying multiples, you can log on to the National Organization of Mothers of Twins Club. That's at nomotc.org. You're going to find tips. You can also find local groups in your area for parents of twins.